Hi everyone. So today's topic is we're looking at diseases of undernutrition. So we're looking at a few different diseases, the first one being anemia. So you've probably already heard about anemia, and it's the deficiency um, of red blood cells. Now that can either be related to the number or quality of red blood cells. So the main purpose, as you guys already know, of red blood cells is to carry oxygen around the body, and the way that's done is through using a protein called hemoglobin. So iron is required to make hemoglobin, which is how iron relates to red blood cell deficiency. So a result of anemia can be either you have iron deficiency, so you have a lack of heme iron, or folate deficiency or B12 deficiency. Now, there is a special type of anemia called milk anemia that does occur in children between the ages of 1 and 3, and that's where milk actually replaces iron-rich foods in the diet. So there are several other causes of anemia, including malabsorption, inherited diseases like sickle cell anemia, bone marrow diseases such as cancer, blood loss, so that could be due to trauma or surgery, or heavy menstruation, or bowel cancer, or frequent blood donations. You can also get anemia if you have an infection such as a malaria or septicemia, and if you have a period of high growth or energy requirements such as puberty or pregnancy. So iron deficiency is the most common cause of anemia and does affect more than 1 billion people in the world. So the people that are at a higher risk of iron deficiency include women that are anywhere in their reproductive years, pregnant women, infants and young children, teenagers, as well as vegetarian and vegans. So there are several stages of iron deficiency. So usually what happens is you have iron stores that start to diminish, and this means that the transport of iron decreases, and then hemoglobin production, which is is used to make your red blood cells, declines in production as well. So some of the symptoms of iron deficiency include tiredness, a loss of appetite, motivation, or enthusiasm, reduced energy, behavioral problems, and paleness. So you can see over in this diagram here that the person that has anemia tends to be pale in comparison to a person that is not anemic. Some other more interesting, well, maybe the last one, symptoms of iron deficiency is that you suffer as want to eat non-food substances like clay or dirt. And another symptom is premature deaths if the mother is a severe sufferer of anemia. So that's why it's really important if you become pregnant that you make sure you have all of your micronutrients consuming in the right levels. So as I mentioned before, there are two other types of anemia. There's folate deficiency, which is also a type of anemia where blood cells can't carry oxygen properly. Doesn't really occur in Australia, but does occur for infants that are fed on goat's milk, which is why they recommend that you feed your children cow milk. So another type of anemia is a result of a lack of vitamin B12, which is called pernicious anemia. And that's where the stomach is damaged, and as a result of this, the hydrochloric acid necessary to digest protein isn't there, which means that you can't access the iron in the protein and it's not absorbed. So vitamin B12 deficiency can be treated through injections or a nasal spray. So there are a whole bunch of good food sources of the two different types of iron, as well as folate and vitamin B12. So if you are a vegan, you can't actually get your heme iron from anywhere, which means you need to get heme iron supplements. But good sources of non-heme iron include legumes. Your folate is your leafy green vegetables, your whole grains, and your avocado. And vitamin B12 is usually found in fortified soy milk. So good sources of iron as well as folate and B12 for non-vegetarians. So meat for heme iron, egg yolk for non-heme iron. If you're looking for folate, offal is a good example, and vitamin B12 found in good quantities in meat as well. So the second undernutrition disease that we're going to look at is osteoporosis, which is usually a condition for older people. And this is where the bones become porous and fragile. And this is due to a loss of minerals, whether that be calcium or phosphorus. So calcium is the main micronutrient, but vitamin D, C, and A all contribute to the absorption of calcium. And then we've also got phosphorus in there as well. So your peak bone mass is achieved by most people in their late 20s, and this actually protects against age-related bone loss as well as fractures later in life. So some of the risk factors for osteoporosis include your age. So if you, depending on your age, that will either increase or decrease your ability to develop osteoporosis later in life, as well as your low BMI. So those people that tend to are underweight tend to lose bone and muscle strength and are more at risk of developing osteoporosis as they age. So other risk factors include gender. So men tend to have a greater bone density than women, and ethnicity as well. So African Americans and Northern European people have denser bones, whereas Caucasians, Chinese, Japanese, Mexican, Hispanic, and Inuit people generally have less dense bones and are therefore at greater risk of osteoporosis. So other risk factors include physical activity, because weight-bearing exercises actually promotes bone strength, which is really important. And then you've got muscles that work when they pull on the bones, and this actually promotes bone strength. So if you smoke, you're also at risk of developing osteoporosis. Alcohol, as well as caffeine and sodium, can also increase your risk of osteoporosis. The last disease that we're going to have a look at is diverticular disease. So this is a result of diverticular disease is constipation. So this is discomfort by the inability to pass soft stools. Most people in Western countries are constipated by world standards, but usually are unaware that there's anything wrong. And most causes of constipation include lack of fiber, lack of physical activity, and lack of water. So what happens is that water is removed from the fecal matter in the bowel. So long periods of contact with the bowel walls dries out the stool and causes irritation and inflammation of the bowel. And what this does is actually causes the bowel wall to rupture, and it forms a pouch, or what's the technical term for that is diverticular. And this pouch can then become inflamed, or in severe cases can actually become infected or ruptured. So some of the risk factors for diverticular disease include abdominal cramps, not risk factors, symptoms, abdominal cramps, bloating, painful bowel movements, bleeding when passing a bowel motion, diarrhea, vomiting, fever, chills, and nausea. So ways that you can actually reverse symptoms and lower your risk of developing this disease is to make sure that you drink plenty of water, that you exercise regularly, that you add fiber to your diet, and you avoid straining when trying to pass a bowel movement. So some other related conditions to diverticular disease include a hernia, hemorrhoids, and varicose veins.